Now, a woman from Sheffield who was bitten by a tick says it's changed her life forever.
Sarah Barrett doesn't remember being bitten, but she contracted Lyme disease, which took years to diagnose and has caused a string of long-term serious health problems for her.
It's estimated that around 3,000 people are bitten by an infected tick every year, and that number is increasing, as Heidi Tomlinson reports.
For Sarah Barrett from Sheffield, one tiny bite from a tick during travels around the world means medication for life. Sarah has Lyme disease. There are many symptoms. It took years to diagnose. During the illness, Sarah recorded video diaries.
I can't hardly get out of bed. My back is absolutely killing me. My head for the last 2 days has felt like somebody just hit it. The tinnitus and the flashy lights is like somebody's having a rave in my head and there's only me invited. I feel really nauseous. I feel really tired.
Lyme disease is caused by bacteria carried by blood-sucking ticks which feed on animals and humans. It's possible to pick up ticks without realising, brushing through vegetation in moorland areas or forests. But you don't have to be hiking through the moors to be bitten. This is a small pocket of woodland close to the M62 with houses very nearby. Living just 200 metres from dense growth increases your risk of contracting Lyme disease. A bite causes a distinctive bullseye, circular red rash. The disease can be cured with antibiotics if detected straight away. It's estimated there are around 3,000 new cases every year. There's no vaccine, but researchers at the University of Huddersfield are trying to find a way to treat it more effectively.
Having a greater understanding of the biology behind the bacteria which caused the infection, we hope to dissect the mechanisms by way it replicates, so we can perhaps target those areas for potentially targeted with drugs to actually result in better patient outcome.
While scientists search for an antidote, the message is to simply be aware, know what Lyme disease is and what to look for.
The key to this is getting it when it happens. It's making people understand that if they see the bullseye rash, that they need to go and get antibiotics. If things are found at that early stage and diagnosed, because, healthcare professionals have to have that knowledge.
Since a course of intravenous antibiotics, Sarah generally feels stronger after a decade of Lyme disease taking control. Heidi Tomlinson, BBC Look North.
Well, Sandra Pearson is the medical director at the charity Lyme Disease Action. Thank you for joining me, Sandra. Now, we should be clear, not all ticks carry Lyme disease, do they?
Yeah, in the UK, not all ticks carry Lyme disease. Maybe 0 to 16% may be infected. So it's important to recognise that, yeah.
And how concerned are you about Lyme disease here in Yorkshire?
In Yorkshire, probably have far less confirmed cases than places like the South, the South West, the Scottish Highlands, which probably have 6 times the number of cases that Yorkshire has. As they were saying, you can be exposed to it places like the North York Moors, Yorkshire Dales, but also in urban parks and gardens.
As we heard there, it's very debilitating for Sarah, and the key is to catch it early. What's the advice if someone has been bitten by a tick?
Ticks can remain attached for up to 5 days. They need removing as soon as possible. Don't smother them with Vaseline or nail varnish, so use a tick removal tool like tick hook or tick tweezers. In an emergency, a loop of thread. Pull it out, and antiseptic. Watch the site. Now, not everybody gets that bullseye rash. Maybe only 2/3 of people will notice that. Other symptoms can be symptoms of a summer flu, sort of headache, feeling unwell. Go and see your GP. It's more treatable at that stage with a course of oral antibiotics, and if left to get into the system, can become more complicated to diagnose and treat.
I guess the key is early diagnosis, but also doctors being aware of the symptoms of Lyme disease.
Yeah, patients and doctors, so that both got accurate information and they can come to a treatment decision together, because the tests in those early stages are not that sensitive. They depend on picking up antibodies which may not have formed.
Sandra, thank you for joining me.